Good day everyone and welcome to Nurses Lecture YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible. As a student nurse, I was posted to the world for my clinical posting, and getting there, the first question they asked me was, "Student Nurse Mercy, what is PCV?" I was mute. I was confused. I don't know what PCV is, but I can tell you what packed cell volume was all about. You can see how confused I was. But today, we're going to be talking about blood test abbreviations. But before we go into details, can you click on the subscribe button and turn on the notification button so you don't miss out. Let's go there. Back. Like I earlier said, today we're going to be talking about blood test abbreviation. The first is the PCV. The PCV that actually got me confused. The full meaning of PCV is packed cell volume. Packed cell volume. PCV is also known as your hematocrit value. It is actually the percentage of red blood cell in our body. The percentage of red blood cell in our body. You hear the doctors asking for the PCV of the patient. When the patient arrives at the hospital, the patient is looking anemic, the patient is about going to the theater. All these things are very, very important. That is that for the PCV that got me confused. It is simply the packed cell volume. Then the second is the ABG, which is arterial blood gas. Arterial blood gas is the amount of oxygen and carbon dioxide present in the blood. Arterial blood gas. It is the amount of oxygen and carbon dioxide that are present in our blood. That's ABG. Then the second is BUN, which is blood urea nitrogen. Blood urea nitrogen. Blood urea nitrogen actually helps to determine the number of waste in your bloodstream. And if it's very high, it simply means there's problem with the kidney or the liver, because they are the one that helps with the waste products in our body. So the other one is CBC, which is complete blood count. Complete, that's complete, everything about blood. It actually helps to analyze the blood completely, to know the healthy status of our blood, the red blood cells, the white blood cells, the platelets. It helps us to know everything about the blood, to know how they are doing. Are they fine or they are not fine? Then the other one is the ESR, which is the erythrocyte sedimentation rate. As the name implies, erythrocyte is red blood cell, sedimentation, something to go down, rate. Erythrocyte sedimentation rate is the ability of the blood to go down, that's to sediment, to go down in the tube. So erythrocyte sedimentation rate can help tell you that there's inflammation in the body. Can help tell that there's inflammation in the body. Then the other one is RBC, which is a popularly red blood cell count. Your WBC, the white blood cell count. Then when you see something like HGB, know they are talking about your hemoglobin level. Hemoglobin is the pigment found in red blood cells that helps to transport oxygen and carbon dioxide. So when you see PT, PT is the prothrombin time. This is involved in the blood clotting. It helps to tell if your blood is clotting, going to clot fast or going to clot slowly. Then HDL is high density lipoprotein. Then LDL is low density lipoprotein. The one that is needed in your body is this high density lipoprotein. So these are some abbreviations that I really want to share with us today, and I sincerely hope this video helps to explain this. If there are any questions, kindly drop on the comment section. If you have an abbreviation that you would like to share with us, drop on the comment section. Don't forget to watch our previous voice notes and always stay tuned for our next video. Thank you very much and do have a wonderful day ahead.